The future is one where patient engagement is not a separate or extraordinary thing, but rather good clinical practice, good regulatory practice, and business as usual. It's partnership that's about understanding what people want and need and how they live their lives. It's bi-directional communication, and it's action. Gender parity is critically important in impacting patient outcomes and for fairness at every level of healthcare and in every sector of healthcare. We need women in senior leadership so that we can address health policy issues and other issues that disproportionately may affect women and historically have been decided on by men. In medical ethics, one of the core tenets is justice. And one of the manifestations of justice is gender equity in healthcare and also for the people who are providing it. And it's good business. Companies that have women in senior leadership are more successful than those who don't. Time's up healthcare, as it should be everywhere else. I'm proud and grateful for any initiative that I've been involved with that was around patient centricity. And if I have to pick one, it's one that was an Innovative Medicines Initiative project, EUPATI, European Patients Academy. Now sustained by the European Patients Forum, EUPATI is a patient-led collaborative expert training program that has to date graduated more than 150 expert fellows who are quite active in the community. It is a project that included development of 4 guidelines that had now been published related to patient engagement, and an extensive toolbox that was rigorously developed and as of last October surpassed 1 million users around the world. So I would say that EUPATI is a flagship enduring program that was focused on but really extends far beyond Europe in its relevance and scope. Yes, that is my 6-word story. And I thought of it because when I was in clinical practice in the intensive care unit, I had to get physically very close to patients and their families. And often on my white coat, I would get blood, sweat, tears from them and from me that would become embedded in the fabric of the white coat and really wouldn't come out in the laundry. Much like they've become, and those experiences have become embedded in my personal fabric and what I need to call upon every time I do my work, whether it was in clinical practice or in the pharmaceutical industry. It keeps my focus crystal clear with the images of people who I've had the privilege of caring for and caring with.